Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's focus on edema and some important points. Edema is a result of the movement of the fluid from the vasculature into the interstitial spaces. And the fluid may be protein poor, so it can be protein poor. That is the transitate. So protein poor means it is transitate, and the protein rich means it is the exudate. Now what are the causes? The causes is it includes the increase in the hydrostatic pressure. So there's increase in hydrostatic pressure, and this means it is a heart failure. So increase in hydrostatic pressure means it can result in heart failure. Now next is the decreased colloid osmotic pressure. Decreased colloid osmotic pressure means that it is caused by the reduction in the plasma albumin. So there is decrease in plasma albumin. So what happens with the plasma albumin? Albumin, it decreases, and either due to decreased synthesis, example it can be protein malnutrition, liver diseases, or due to increased loss. There can be increased loss. So increased loss can be due to the nephrotic syndrome. Next is there can be due to the increased vasculature. So vasculature permeability or vascular permeability, increased vascular permeability. So this is nothing but the inflammation, which is usually localized but may occur throughout the body in severe systemic inflammatory states such as sepsis. Then the lymphatic obstruction, this is in case of the infection or neoplasia. Then we have the sodium as well as the water retention. So the sodium and water retention is seen in case of the renal failure. To learn and grow daily like this, please do subscribe.